The biggest mistakes patients make after weight loss surgery and how to avoid them. One of the biggest mistakes that patients run into in the immediate postoperative period is the dietary changes that are required. When we talk about the mistakes patients make after weight loss surgery, we can break it down into the immediate post-op period and then more of the long-term period after surgery. Immediate would be about the first 6 weeks or so after surgery. The first problem we run into very frequently is the dietary changes that occur right after surgery. Patients may often make a mistake and drink too quickly or drink too much. For the first 2 weeks after surgery, you're on a liquid diet. And generally what we recommend is taking small sips rather than large gulps. We also recommend that you stay on top of those small sips by drinking every 30 minutes. And we usually recommend about 1 ounce of liquid every 30 minutes while you're awake during the day. This can avoid another common issue that can happen is dehydration if patients aren't taking the liquids in regularly as they should. So that's one common mistake is gulping or drinking too much all at once, which can cause you to be very uncomfortable or even hurt. Another mistake that patients can make is progressing too quickly in their diet right after surgery. Most of the time, patients should follow our dietary manual, and in there it's very clear on what phases of the diet to follow. Patients are educated by dietitians and given a manual about the diet required in the postoperative period. A common mistake that we can run into is that patients may move their diet along too quickly and forget what they learned in the dietary manual. Oftentimes, if you move to solid foods too quickly before seeing us in the office, it can damage your staple line from the surgery or cause pain. The way to avoid this is to follow the dietary manual that is given to you as a patient. Another common mistake is that after patients are eating solid food, they eat too quickly or don't chew their food enough. So a simple rule is if you take a bite every couple minutes and chew your food until it's very soft, almost pasty in your mouth before you swallow, usually that takes care of the problem. Another issue that we run into in the immediate postoperative period is dehydration if patients are nauseous or they aren't drinking enough. For this reason, we generally recommend 1 ounce of liquids every 30 minutes to avoid the dehydration. Constipation can also be a problem in the immediate postoperative period. For constipation, we recommend you take a stool softener and a laxative daily. Your bowel movements will be less frequent because you're taking in less food with sediment after surgery. Those are the issues that we generally run into in the immediate postoperative period. In the more long-term postoperative period, there are also some things and mistakes that patients make that we can help you with. Number one, in the long term, make sure that you get enough protein in. Patients are often advised to weigh their food in the immediate postoperative period to make sure you're getting enough nutrients in. Don't stop doing this. You should keep weighing your food even in the long term. And by weighing it, you're holding yourself accountable and you're also ensuring that you're getting the appropriate levels of protein in. A mistake that we can see is patients don't take in enough protein. Without enough protein, you tend to lose muscle mass and your metabolism slows down. So what I generally say as a rule of thumb is if you're having a small plate of food, mostly fill the plate up with protein sources, and that's a permanent change, not an immediate change. Exercise. A mistake patients commonly make is they stop exercising. Exercise is key to this entire lifestyle change. Exercise helps you retain muscle mass so you don't lose muscle. When I say exercise, I like to focus on resistance training and aerobic type exercise. Resistance training is very important because it helps you retain muscle mass. Retaining muscle mass helps with your metabolism and your general health, and then also, actually, believe it or not, helps with your mental health as well. Another long-term issue that can come up is patients not following up for their long-term appointments. Your follow-up is essential to your long-term success. And there's various reasons why patients don't follow up in the long term. One reason can be if they feel like they're not on track or if they have regained weight. This is the time when you need to come into the office and you need to come see us. That's what we're here for. A mistake patients often make is that they're embarrassed about it and they don't want to come in and then it spirals out of control. We're here for your support, and that's the time you need to see us is if you're having an issue or you have regained weight. It's something that we see occasionally, and when it happens, it's okay. And the answer is to come in and see us, and we have a Back on Track program. And this program is for patients that are in the fairly immediate, say within a year or two, and even 5-10 years down the road to come back and see us. And that's what we're there for, is to avoid the weight regain and to make sure you do come in and see us. Another mistake patients make is resuming old eating habits. If patients have a history of a food addiction, or there's certain bad foods that they like and they resume those old habits, that's something you have to be very cognizant of and break away from any of those habits. A nice way to avoid those habits is just don't put any of those things in the house. Any of those old bad foods that you had a problem with in the past, just keep them out of the house, and then the temptation's not there. And then lastly, stress management and mental health. Patients do have to make sure that they take care of their mental health, and a lot of times this gets forgotten, and that's a mistake we see as well. Not managing your stress appropriately can lead to problems with weight regain in the long term, and that's why it's really important that you manage your mental health and stress levels. Stay informed, follow us for more guidance on bariatric surgery.